Well, before I ever speak in front of a group of people, I always like to give my disclaimer that due to the nature of my own health issues, it does affect the way I speak. And I might sound out of breath at times, or maybe a bit slurry. So ever, if you can't understand me, please raise your hand. I'm okay. I like to sit so I don't lose my balance, and I don't want it to be a distraction ever, and I can hear you just fine. So I always like to start with that, more for me than for you, but now we all know. Okay, so naturopathic medicine in Indiana. So, like Aaron was talking about, this is really all about building bridges. Because the more we can know about what we all do, what we're up to, what our concerns are, the more we can provide for each other and be the best practitioners we can be. So I wanted to start with some of our forefathers' quotations. The doctor of the future will give no medicine, but will instruct his patient in the care of the human frame, in diet, and in prevention of disease. Hallelujah. Thomas Edison. And then Hippocrates said a long, long time ago, if we could give every individual the right amount of nourishment and exercise, not too little and not too much, we would have found the safest way to health. I mean, how pertinent is that today? And the way I really see it, and often I'm described as an alternative health care provider, which I think is really kind of funny. Like, I should be the conventional, we should be conventional. We should always start with diet, nutrition, stress level, exercise. Like, what can I affect in my most inner sphere and maybe my outer sphere? And then if those things don't work, then we go to alternative medicine, which is surgery and drugs, which they all have a place. But why is that the first place we go? And then when that doesn't work, they show up at my door. It's like, well, we could have done a lot more before you cut something out. Anyway, next slide. So this is just a basic outline of what I'll be talking about. What the medicine is, my education, the licensing issues, because there are many. Our philosophy, taking the best of both worlds, at least we hope. So you have your modern science and cutting edge laboratory testing, and blend out with your ancient traditions and kind of timeless medicine, like homeopathy and food and herbal medicine, and you combine that and make a really holistic treatment plan for everyone. You have, what I think, a great model. So there are all different types of modalities and treatments that we use. So my education, there are different kinds of naturopaths out there. Not one is better than the other, it's just they're different. I went to medical school in Portland, Oregon. First 2 years were spent like Dr. Dharma. You know, we studied all of your ologies, your biology, anatomy, physiology, oncology, urology, neurology. It went on and on and on for 2 years. And then the second 2 years were all the clinical rotations, and then all the natural medicine modalities like herbal medicine, homeopathy, physics. And I want it to be known, like, I'm so not anti-drug and anti-surgery. I'm very pro those things. I just think there's a time and a place of when they're appropriate. And we did learn pharmacology, so That takes me to the next slide. So, the good news and the bad news is that I don't have a license here. And we're working as hard as all 11 of us in Indiana are working to move that through legislation. These are the states that we're licensed as primary care physicians. We have, like in Oregon, where I carry my license. If I practice there, I can prescribe any medication, I can do minor surgery, and practice like a primary care doctor. We're working very hard. So here I'm limited in what I can do, but I still have a huge toolbox in which to work. Okay, so the tenets that guide naturopathic medicine, no matter what we're doing, who we're treating, what we're treating, I'm always looking at this. First, do no harm. That's like Hippocratic oath. We all swear to that. Treat the whole person. Doctor is teacher. I spend most of my time educating people, educating myself. And, you know, we've had the talks here, those of you that have been here, and that's truly my passion. And then the trickiest one of all, I think, is treating the cause. Because it can be very complicated, trying to uncover and unweave the tightly woven tapestries that are our bodies. And always practicing preventative medicine. And then I believe this is really what sets alternative healthcare providers apart, is our strong belief the body knows how to heal, and it's very wise. This is just a list of common issues, complaints, ailments that someone... So what I always tell a patient is that I cannot promise miracles. I don't have any magic. That being said, I have seen miraculous things happen and magical things happen. But what I can promise is I will never, ever run out of tools. A lot of patients come to see me because their doctor is like, I don't know what else to do. The steroids aren't working, the antihistamine's not working, the pain, whatever, you name it, it's not working. When you have the earth as in your toolbox, we never run out. Give me water, give me air, give me some plants, and we have medicine. Some of these I cannot do, obviously, because I'm not in a licensed state, but I'm trained to do them. Next slide. So a naturopathic approach is, you know, very, in some ways, systematic, you know, but individualized, where there's a hierarchy of cure, where the very first thing I'm always doing with the patient is looking, what's in the way of you getting well? Is it a food? Is it a stress? Is it a way you're sitting? Like, what's in the way or what's not there? And let's add that. And then we add on the layers, like, how do we stimulate the body's own self-healing process? Is it a nutrient that might be missing? Or homeopathic medicine, so acupuncture, homeopathy, exercise, all help stimulate the self-healing process, and then we start supporting weakened and damaged systems. And it's like, if these things are still not working, like I said, then we address that, address the pathology, and perhaps suppress it. Most of our medicine, you think about our drugs, they all start with the anti. And that whatever the body is doing, there's a reason why it's doing it. And it's our job to ask why. Okay, next slide. So I always show this picture to my patients. I have a big flip chart that I go through with them of how impactful stress is on every single organ in our body. Our thoughts, our emotional stress, our financial, geographic, genetic susceptibility, chemicals, lifestyle, you know, your stomach, your spleen, your intestines, your kidney, your liver, your sympathetic nervous system, everything is being affected, and this is a very important tool that I use to help express that depending on what's going on. Okay, so I love her. She's doing it all, like we all are trying to do, and most of the time we cannot affect the amount of stress that's coming at us. It's the way we live in our culture today, and you really, really have to put your feet on the brakes to slow down. So I tell people, you know, we have some choice, but what we can affect is our internal resistance. And I think that's really empowering, and it's time that we are empowered with our healthcare, and that's one of my number one goals, is for us to take responsibility for our bodies. It's definitely up to us as healthcare providers to provide information and support, but it's really the responsibility of the client, consumer, patient to be empowered. And that's where this is. The more we can control this, the less distress and